My name is Chris Greenfield, and this is my presentation on the role of norepinephrine and epinephrine in psychiatric disorders. Epinephrine and norepinephrine are catecholamines, which are neurohormones produced by the body in response to stress. They are almost identical in their chemical structure and have similar effects on the body for the most part, with some significant differences. Neurotransmitters can be excitatory or inhibitory, and sometimes even both. Epinephrine and norepinephrine bind with adrenergic receptors due to stress and typically accelerate the metabolic and physiologic processes of the body. Norepinephrine is released continuously in small amounts and can be thought of like the gasoline that an engine needs to run. Epinephrine, on the other hand, is similar to a turbocharger that gives an added boost when needed. Both of these neurotransmitters play an important role in the fight, flight, or freeze response when the body is under stress. They cause an immediate increase in heart rate and contractility. Blood vessels constrict, thus raising blood pressure. Pupils dilate in order to take in more light. Bronchioles dilate in order to take in more air, and glucose production increases. All of these actions help the body to prepare for fight or flight, or to freeze. There are two categories of adrenergic receptors, alpha and beta, and these are further divided into alpha 1 and 2 and beta 1 and 2. Alpha 1 receptors are found in blood vessels, reproductive and GI tracts, and in the urinary sphincter. Stimulating these receptors causes vasoconstriction, resulting in increased peripheral resistance, mydriasis, perspiration, and urinary retention. Alpha 2 receptors are found in pre- and postsynaptic neurons, and also in the brain in the locus coeruleus. And these receptors inhibit the release of norepinephrine and acetylcholine, as well as insulin. Beta receptors are found in the heart and lungs and are more susceptible to epinephrine. Beta 1, remember one heart. So beta receptors are in the heart, and when they are stimulated, they cause tachycardia, increased myocardial contractility, increased lipolysis, and increased renin release. All of these things result in increased cardiac output and increased blood pressure. Beta 2 receptors cause vasodilation and bronchodilation, as well as smooth muscle relaxation and increased glucose production. So norepinephrine has a stronger effect on alpha adrenergic effects, while epinephrine has stronger beta adrenergic effects. Epinephrine is produced in the adrenal cortex, whereas norepinephrine is produced in the adrenal medulla. Norepinephrine is also produced in the locus coeruleus in the pons in the brain. And deficiencies of both epinephrine and norepinephrine can cause anxiety, depression, fibromyalgia, migraines, restless leg syndrome, and sleep disorders. To continue with the car analogy, with deficiencies, the engine isn't working as well and needs some help. However, excess epinephrine and norepinephrine can also cause anxiety, and also hypertension, excessive sweating, heart palpitations, and headaches, to name a few symptoms. Excessive epinephrine has been linked to PTSD. In an experiment with mice who were traumatized, the freeze response indicating fear was triggered by increasing epinephrine levels, and both an excess and an insufficient amount of epinephrine and norepinephrine can cause anxiety, while decreased norepinephrine alone can cause depression, and it's also implicated in Alzheimer's disease. On the other hand, elevated levels of norepinephrine are associated with schizophrenia. Understanding the difference and the relationship between psychiatric illnesses and these neurotransmitters allows clinicians to prescribe medications that either suppress or increase the effects of the neurotransmitters, thus modulating the patient's symptoms.